You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you so much for joining the show. I'm going to talk to you today about the links between gum disease and Alzheimer's, dementia, and cognitive decline. Now, you would never have thought that mainstream science would have caught up to where holistic dentistry was when I started doing this over 20 years ago. But here they are now backing everything that we've been saying about the links between your oral health and your overall health. So if you want to live a long, healthy life with great quality of life, then you've got to have a healthy mouth. So before we get into that, if you want to know more, then you can hop on over to holisticdentistry.au or check out my dental office website, evolvedental.com.au. That's EVOLVE dental.com.au. So let's get in the zone and let's talk about Alzheimer's and gum disease. Well, Alzheimer's is on the increase, and we are having to ask ourselves, why is that? What's going on with our population that we're seeing these increases in Alzheimer's, dementia, and cognitive decline in particular? Now, you could say we're living longer, people are aging, but the numbers don't seem to stack up per capita, and Alzheimer's and dementia is happening at younger and younger ages. Is it our diet? Is it our lifestyle? Is it genetic predisposition? Or is there more going on? Now, currently, more than 6 million adults in the US alone have Alzheimer's disease. And this number is growing, and it's expected to increase by nearly 13 million by the year 2015. So that means that nearly 20 million people in the US alone will have Alzheimer's. Now you've got to start asking questions as to why is it? The causes of this devastating condition are hotly debated, but there is a consensus that there are multiple factors that play a role, from your gut health to your oral health. Now, periodontitis, which I've talked about in my previous episodes, or gum disease, has been suggested as a potential risk factor for Alzheimer's since at least 2015, when researchers at the University of Bristol noted that periodontal pathogens, so germs from your gums in your mouth, were contributors to neural inflammation, which can cause the onset of Alzheimer's disease. Now, patients with Alzheimer's often have poor oral health, and that has usually been attributed to the fact that they're old, they have a declining self-care, and they've neglected their oral health, and their caregivers have done the same. But now it's being recognised that it's not an after an event occurrence, but that periodontal disease, severe gum disease, where you're losing the gum tissue from around your teeth and the bone from around your teeth, is a contributory factor to disease development. So it's not just something that happens or might be linked, it is contributing to the development of Alzheimer's disease. Now, gum disease pathogens have been found in the brain. In 2019, researchers with the University of Louisville identified that P. gingivalis, a pathogen involved in chronic periodontitis, was found in the brains of patients with Alzheimer's. There are gingipanes, I think that's how you say it, which is a toxic protease, which is a kind of protein from the P. gingivalis bacteria, were also found in the brains of Alzheimer's patients. These levels of gingipanes were associated with two markers of the disease, the tau protein and another protein called ubiquitin. Now, they've done studies in mice. So they've shown in mice that oral infection with the P. gingivalis resulted in brain colonization of the pathogen with an increased production of amyloid plaques. So previously, the bacteria associated with gum disease had been found in the brains of people with Alzheimer's, but it remained unclear what role, if any, it played in the development of the disease. Well, in these recent studies, researchers were able to show that mice that were given the P. gingivalis bacteria, that was then found in the brain alongside high levels of the hallmark Alzheimer's protein, the protein amyloid. Now, studies showed that gingipains were neurotoxic, which damages your brain, and damages tau, which is needed for normal nerve and neuronal function. Now, researchers designed small molecule inhibitors to target these gingipains. The bacterial load was reduced, and also the neuroinflammation and the production of the precursor to that amyloid was also blocked. This data suggests that the gingipain inhibitors could target the P. gingivalis in the brain and treat treat the neurodegeneration from Alzheimer's disease. Now, the P. gingivalis has also detected in the brains of people without Alzheimer's, leading to support this theory that it's involved in the development of the condition and not simply a byproduct of it. So according to this study, the identification of the gingipain and antigens in the brains of individuals with Alzheimer's and also with Alzheimer's pathology but no diagnosis of dementia argues that the brain infection with the bacteria P. gingivalis is not a result of poor dental care following the onset of dementia or a consequence of late-stage disease, but it is an early event that can explain the pathology found in middle-aged individuals before they have cognitive decline. So what they're saying is that gum disease is not the chicken and egg thing. It happens before the Alzheimer's. It happens before pathology. It causes pathology, and pathology that happens before cognitive decline. So they're now looking at ways of stopping that happen in the brain. But I go, hang on, let's take a step back, and we should be preventing and properly treating gum disease in all our patients as dentists with a view to helping limit and prevent the onset of Alzheimer's disease in the populace. But that also means that you, the interested individual who cares about your overall health and well-being and understands that there could be a link between what's going on in your mouth and the rest of your body, you can be proactive and ensure that you have a healthy mouth, healthy gums, don't have gum disease, and reduce your risk, hopefully, for Alzheimer's. So what am I saying in this intro? Basically, that the same bacteria that cause severe, let's say mild, moderate to severe and advanced gum disease called periodontal disease are also found in the brains of people who have pathology for Alzheimer's, whether they have cognitive decline or not. And therefore, poor gum health is not as a result of Alzheimer's then allowing bacteria into the brain, but it's poor gum health that allows bacteria into the brain before you get Alzheimer's. So, periodontal disease is linked to increased Alzheimer's risk. There is reviews of many studies that showed the risk of Alzheimer's and mild cognitive impairment in patients with periodontal disease was significantly higher than in those without periodontal disease. And this is especially true for people with severe or advanced, or what we call stage 3 and stage 4 periodontal disease. A separate study that was published in the Journal of Alzheimer's Disease found that among people aged 65 and older, Alzheimer's disease incidence and mortality were consistently associated with probing pocket depth, which is a measurement of periodontal health, as well as certain types of bacteria, which were the bacterial markers of periodontitis. The study provided evidence for an association between periodontal gum disease pathogens and Alzheimer's disease, and that association was stronger in older adults. And what's more, the risk of cognitive decline in older men increases the more teeth are lost, while periodontal disease and tooth decay, both of which contribute to tooth loss, are also linked to cognitive decline. So who would have thought that the state of your teeth, the state of your gums, and how many teeth you do and don't have determines whether you are at higher risk for Alzheimer's and cognitive decline than those who don't have it. So let's look at how gum disease leads to Alzheimer's. Now, it likely contributes to Alzheimer's by increasing pro-inflammatory mediators, including C-reactive protein, different types of interleukin, and a thing called TNF, which I can't remember the acronym for that right now. If it comes back to me, I'll let you know. Otherwise, I'm going to ask you to go and look it up. Now, according to researchers within the University of California Dental School, there are 3 primary mechanisms that have been identified for how periodontal gum disease leads to Alzheimer's. So you get the increase in peripheral pro-inflammatory cytokines that systemically affect the brain via neural, humoral, and cellular mechanisms. You get the ectopic migration of periodontal bacteria and related molecules directly to the brain via blood and or cranial nerves. The tissue covering the brain and spinal cord, which is called the leptomeninges, may act as a mode of communication between the periodontal pathogens and the microglia in the brain. So that's like little nerve bundles in the brain. Now, there are many studies that firmly place P. gingivalis as a risk factor for Alzheimer's. And this is because this bacteria is very adept at modifying the peripheral and intracerebral immune responses. It has a range of enzymes that are respectively shown to interact with the amyloid precursor protein and neuronal tau, resulting in formation of amyloid beta and neurofibrillary tangles, NFTs, which are cardinal hallmarks of Alzheimer's disease. Now, as a little aside, neurofibrillary tangles are also created by exposure to mercury. And you get exposure to mercury if you have dental amalgams, the silver metal fillings in your teeth. So I would encourage you to also listen to the episodes about mercury and amalgam and safe amalgam removal if you are concerned about your cognitive health and well-being and you want to avoid your risk for dementia. Anyway, on studies, they have shown the risk of developing Alzheimer's disease doubles when periodontal disease has persisted for about 10 years or more. Deposits of amyloid beta in the brain tend to start 1 to 2 decades before noticeable signs of cognitive decline and the diagnosis of Alzheimer's. And periodontal disease may also be persistent for about 10 years to initiate Alzheimer's. Positive oral health early on may prevent and help to prevent the disease from occurring, that is, Alzheimer's. So this is not just information that I'm sharing for older adults or middle-aged adults, like my son likes to remind me I am now that I'm in my 50s, but also for younger adults. Because if you can protect your brain health by maintaining good oral health, even when you're young, otherwise healthy adult, that makes sense to me. Protect your teeth and gums now to protect your health later. Even in young, otherwise healthy adults, episodic memory and learning rates are improved among those it's improved among those with good oral health compared to those with aggressive periodontal disease, suggesting that damage to brain health actually starts much earlier than we've considered. So proper oral hygiene, including regular brushing, flossing, tongue scrapings, getting regular cleans with a plug, mercury-free, holistic biological dentist like myself will go a long way to keeping your teeth and gums healthy. You also need to have a healthy lifestyle that includes a diet based on fresh whole foods and having good optimal nutrition, and that is essential to a naturally clean mouth and good oral health. So what else will contribute to Alzheimer's? Well, Alzheimer's is a complex condition, and oral health, or lack of it, is only one contributing factor. Gut health is another, and a team of Swiss and Italian researchers have found a connection between the imbalanced gut microbiota and the development of amyloid plaques in the brain. They used PET imaging to measure amyloid deposition in the brains and then measured markers of inflammation and proteins produced by intestinal bacteria such as lipopolysaccharides and short-chain fatty acids in the blood. The study revealed that high levels of these lipopolysaccharides and short-chain fatty acids are associated with large amyloid deposits in the brain. Other short-chain fatty acids, though, appeared to have a protective effect. High levels of butyrate were associated with less amyloid. Now, certain bacterial products of the intestinal microbiome correlate with the quantity and quality of amyloid plaques in the brain. It's not surprising then that something as simple as taking a regular probiotic have proven to be protective against Alzheimer's. Patients who had probiotics this is Alzheimer's patients who were given probiotics experienced significant improvements in cognitive function. And guess what? Probiotics, by the way, are also useful for managing periodontal disease. Yes. Hello, your mouth's part of your gut. It's got microbiome. It's got loads of good and bad bacteria. If we get probiotics in there, we have gut bacteria and we have good oral hygiene. Now, what else? There's electromagnetic exposure. There's radiation voltages that can affect your calcium channels in the cells. And the greatest number of these calcium channels are in your brain and the pacemaker in your heart. Now, if you are exposed to EMF, is there a link between that and Alzheimer's disease? Well, it seems to be that if you are exposed to a lot of this EMF, it can cause widespread, very, very early onset Alzheimer's in human populations. So it could be that excessive microwave exposure and mitochondrial dysfunction are some of the most significant factors contributing to Alzheimer's, along with exposure to herbicides like glyphosate, which also has negative neurological effects. So imagine you're a human being who's exposed to EMF, herbicides like glyphosate, you've got mercury fillings, you've got poor oral health, you're ingesting fluoride, which also causes cognitive decline, and you wonder why you might go on to have Alzheimer's. Now, I would say that there's some of the neuroenvironmental toxins that we are exposed to. But you've also then got to look at how we are emotionally and how we are mentally. And I don't mean like mental ill health, but are we present? Are we focused? Are we with ourselves when we're doing things? Or are we checking out? Are we switched off, disengaged, disconnected from our bodies and the task at hand? Are we thinking about other things? Are we reminiscing? Or, I'm doing something and I'm thinking about all the jobs I've got to do later in the day or the conversations I've got to have. How can our brains stay present if we're constantly pushing it to jump backwards and forwards in time and not be engaged with exactly what we're doing in that moment? Now, I suspect that in conjunction with all the other things is what sets some people up for Alzheimer's more than others. But that means that there are many, many things that we can do to support our conscious cognitive health and prevent things like Alzheimer's. So how do we prevent it? So nourishing your brain health, that's done with a healthy lifestyle and healthy diet. What you eat is going to affect your oral health and your gut health. It's going to impact your cholesterol level. Cholesterol is essential for the important role in the formation of memories, and it is vital for healthy neurological function. Now, don't get me started on statins, otherwise we'll be here all day. I am not a fan of statin prescriptions because what we're doing is we're pushing cholesterol too low. You need cholesterol to make lots of your hormones. You need cholesterol to protect your nervous system and make the myelin that conducts the electrical signals along the nerve tissue. And without that, you're going to have neurological problems. So I'm all for, we've got to have some good cholesterol going on. We need sufficient fat. If you've got insufficient fat and cholesterol in your brain, you are more at risk of Alzheimer's disease. A low-fat diet and statins may cause Alzheimer's. I've said it. It's not just me. It's been said in studies. PhD, doctorate people are telling us we need to have higher fat in our diet. We are obsessed with putting our elderly on statins and lowering their cholesterol. And I think that is actually the worst thing we could be possibly doing for our elder population. My mum is now in her late 70s. She has slightly higher cholesterol than what they would consider now normal, despite the fact that they keep lowering what normal is, and they keep pushing to put my mum on statins. Now, she doesn't want them. I don't want her to have them. So we sent her for a calcium carotid artery score. She had the ultrasound done. They had no idea why she was there. Her arteries was as clean as a whistle. And they told her she'd wasted her time. And the doctor still wanted to put her on statins despite her calcium carotid artery score being 0. And I'm like, no, you're going to make her have cognitive decline. It's not happening. I've put my mum on a high-fat diet. She has avocado. She has olive oil. She has good fishes and salmons. And I will come to that in a moment. But this push To constantly lower cholesterol is a step in a backwards direction. If, however, your cholesterol is high, that is a marker of inflammation. Cholesterol is a response to inflammatory processes. Address inflammation, not cholesterol. Anyway, let's go back to this. So you've got to have your good nutrition. Then I would say that time-restricted eating, intermittent fasting is an important strategy. I would also encourage you to reduce your intake of polyunsaturated fatty acids, PUFAs, and these are vegetable oils, edible oils, seed oils, trans fat, and plant oils. You've got to go more natural options. That means coconut oil, avocado, olive oil, animal fats, guys. Studies have demonstrated that saffron is neuroprotective and it's as effective as the drug memantine, I think you call it, that they use to treat moderate to severe Alzheimer's. So you've got to address the biochemistry. This has been really well documented. There's plenty of books out there. I think there's one called The End of Alzheimer's. I think it was Breeden who wrote that book. Sorry, I don't have that information in front of me right now. There's some screening tests as well that I think are also mentioned in there. Some of the things that they recommended, though, are the use of exercise, ketogenic diet, optimizing vitamin D, increasing sleep, meditation, which is, for me, meditation is being with my body. So I would say my whole day is a meditation because I'm always, working on being present. It's not about being mindful because I don't do mindfulness, but just making sure I'm in touch with what I'm doing. Then detoxification, so that would be getting rid of mercury, in my opinion, as a holistic dentist, eliminating gluten and dairy, processed food, and particularly sugar. Sugar is just rife. It's bad for you. It's pro-inflammatory, causes tooth decay, causes gum disease. It F's up your microbiome, and it's just evil stuff. So if you want to avoid Alzheimer's, you want to avoid health issues, sugar, hit it on the head. Anyway, I'm ranting. Let's go back. Exercise, ketogenic diet, optimize your vitamin D, increase your sleep, detox, eliminate gluten, alcohol, reduce processed foods. And that is pretty much where I'm to. But as your dentist, as a holistic dentist, there are two things that I would particularly focus on with you as my patient. If you said to me, one of my concerns, Dr. Rachel, is I don't want to end up with dementia like my parents. And I'd go, okay, first and foremost, we've got to treat any infection, inflammation, and gum disease in your mouth. We've got to help you have great oral hygiene. I don't want to be seeing you every 6 months and there's plaque, tartar, bleeding gums, and inflammation. We want you to come regularly, descale, get the gums healthy, keep them healthy with good oral hygiene, diet, exercise, optimal nutrition, good sleep, clean water. Eliminate toxins. Big toxin, mercury. If you've got amalgam fillings, that mercury is leaking. It is neurotoxic. It causes cognitive decline. It causes damage to your nervous system, and it puts you at risk of dementia. So, clean, healthy mouth, address your gum disease, get rid of your amalgams, eat well, sleep well, stay present, have your good fats, exercise, and optimum vitamin D, get out in the sun, don't get sunburnt. And these things have been scientifically shown and research shown to help prevent Alzheimer's disease. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone. Thank you very much for joining me. This is the place for all things oral and overall health, systemic oral health link connection. Check us out, holisticdentistry.au, evolvedental.com.au, my dental practice, Evolve Dental in Brisbane, 0737201811. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.